What is the number one mistake that you can make in your medical malpractice case? Come on in. I'm going to tell you right now. Begin with the story. Patient has cancer and needs follow-up imaging. The doctor orders the follow-up imaging, and for whatever reason, the patient decides not to have it done. They document in the medical record the patient declined the test. No one will ever know why, but they did. A year or so later, this patient's cancer has spread all over the body and it's too late. In every single case that we see in medical malpractice, the doctor or the hospital will try to blame the patient for what happened. How do they do that? They show the patient did not follow medical advice. Here's another case. Patient goes to the hospital and they're complaining of severe chest pain. Worst chest pain of their life. Classic cardiac symptoms. They send the patient home without any testing. No EKG, no blood work called troponin. 5 days later, the patient dies of a massive cardiac arrest. Actually, with a heart rupture. It was so bad. Young person. The emergency medicine doctor tries to blame the patient. I knew this could be a heart attack. I recommended blood work, EKG, admit the patient to the hospital, but she didn't follow my advice. When that's true, that's called against medical advice, AMA. And when that happens, that means the doctor told the patient what to do and the patient ignored the doctor's advice. Here's a critical distinction. In that case, there's no documentation anywhere in the hospital record that the patient didn't follow advice. There's no indication in the medical record that the emergency medicine doctor had recommended additional workup or admission of the patient to the hospital. Nothing. We, as lawyers doing medical malpractice, we can only rely upon what's documented in the medical record. And if they didn't document it, it wasn't done. If they did document that they did these things, that's a total defense to the case. Because if the doctor recommends certain treatment and the patient declines it, that is the patient's choice. There's always other things that the doctor can do, such as explaining the reasons why medical treatment's necessary and having witnesses there to say, you really need to have this done or you could die. And that should be documented. That should be in the medical record, and oftentimes it's not. So just keep in mind with your medical malpractice case, the number one thing the doctor is going to try to do is blame you for what happened. They gave you advice and you didn't follow the advice. And as the attorney, what I'm going to be doing is looking at your medical record to find out, is that true? Did they document the tests and the treatment that they claim now they recommended to you? So that's the number one mistake that we see in medical malpractice cases, is patients failing to follow the doctor's advice. That can be a complete defense to a case. I hope you liked this video. If you did, please subscribe to our YouTube channel. Share the video, comment on it. If you comment, I will definitely respond to your comment, and I'll see you next time.